Hi, good afternoon, everyone. This is Yehudis Schamroth with Wellness Wednesdays. I've taken quite a long break for all kinds of reasons. There were Jewish holidays and there were parents to visit and Corona to have again. So here I am back with Wellness Wednesdays live on Facebook. I also will be going only once a month till the end of the summer due to lots of things happening, but also we're giving everybody a break. There's so much going on out there. So I need a break, and we all do. Anyway, welcome back. And I'm the nurse anesthetist from Ramat Beit Shemesh, certified in acupuncture and Chinese medicine. Good, strong medical background. So when I take care of you, I consider both Western and Eastern philosophies in mind, and alternative medicine, integrated all together. So today's topic is anxiety, depression, and holistic care of mental illness. And anxiety and depression have hit an all-time high, not just in the United States, but all over the world, unfortunately. Okay. It's a discussion that we've been having for a long time in both Western and Eastern medical worlds. Which side of the fence are you going to be on in terms of treating mental health these days? Because a lot has gone on through the years with research and diagnoses with all kinds of medical advances, but we don't seem to be getting any further along in helping prevent a lot of mental illnesses that could be prevented. Now, I'm not talking about things like genetic things, like possibly schizophrenia or something that happens situationally, like post-traumatic stress disorder. We're talking about the things that go on in the brain that we can help make our brain as healthy as possible, which is the more holistic approach. In days past until now, and even now with some people, there's no consideration of what else could be causing mental illness or problems with mental health other than just maybe poor luck, bad luck, bad genetics, or something like that. So we do know now that we have to continue addressing this issue of there's definitely chemical imbalances and there's nutritional imbalances and all kinds of other considerations to take. And for 50 years, we've been just treating things basically with pharmacology, and have we gotten really any good results? Not so sure. So some in the medical field might be the opinion that the newer methods of testing brain chemistry is the only way to go. And the holistic approach, of course, would mean to look at the whole body. So we're looking at things like not just brain chemistry and the imbalances. We're looking at digestive and gut function. We're looking at genetics, and we're looking at all the different things that go into making a person healthy or well or unwell. So we do know that prescription drugs are not always solving the problems for our mental health issues. So what can we do about this? So what we like to do is focus more on the holistic natural approaches to things. We want to understand the underlying causes of mental health issues like anxiety and depression, mood swings, mind racing, brain fog, memory loss. Those are all considered things that are considered mental health issues, even if people don't have diagnoses like psychiatric diagnoses, depression and anxiety included. A lot of depression and anxiety can be prevented or can be lessened to a great degree by just proper nutrition alone, which I'll cover. And to fix all these issues, we sort of have to understand what causes it. So there are many different brain chemicals, as we know. I just have a couple of slides, and I don't want to get too technical. Oopsie, because that's not what this is all about. I went off my screen there. Sorry, there we go. We do know that what's the prevalence of mental health issues? There's 1 in 4 people are affected in mental health issues. Used to be thought of that it was a rare occurrence, but a lot of the reason we thought it was a rare occurrence was because it was a big disappointment for people to have a mentally ill person in their family, or somebody who was depressed or anxious, or even it was an embarrassment, or if it was people are embarrassed themselves to come forward if they feel like they have mental health issues and they think they're not normal and they think they're crazy and all these other things, and it prevents people from reporting the actual case. So it could be even more than 1 in 4. But we do see this with adults and children, truthfully. We have to understand what causes these problems with the chemical imbalances. We do know we have something called neurotransmitters in our brain. This is a title is a little bit misleading because it was meant for the other slide, but this is the synapse, or this is what the nervous system has a basic structure, which is the neuron. And this is one neuron the front of one neuron connecting with the back of the other, and they have this gap in between called the synapse. And this is where all the transmitters are busy plugging into the places they need to plug into in terms of switching things on and switching things off in the brain. And this is part of brain health, is having a good, healthy synapse, a good, healthy transmitter, and a good, healthy transporter, like dopamine and serotonin, which I'll cover now. Okay, we want to talk again about a little bit about the holistic approach. We don't want to just look at the chemicals, but we do know basically in all mental health issues, whether it's mild depression and anxiety or to the severe psychosis and schizophrenia, there is an imbalance of what we call neurotransmitters. And neurotransmitters are either hormones or they're amino acids in our brains that they're messengers. And they're messengers that tell the brain how to act, what to do, regulate us, similar like hormones all over the body. But this is specific to the brain. So in the holistic approach, we do focus on this as well. We don't ignore this. We have to understand the combination of issues, not just the imbalances of the hormones. We want in the neurotransmitters, but we want to know what people are dealing with. We want to get a good full evaluation. This is what I recommend, whether people have medical problems or emotional problems or mental problems. Go get a good evaluation by somebody reputable first, so you know what you're dealing with, because that's where alternative medicine and integrative medicine can really come in handy and work better for you, is because we know what we're dealing with. We know if it's something serious, like God forbid, a brain tumor. You want to rule out any big possibilities. If it's a consistent problem with yourself or your loved one, where you have mood swings that came out of nowhere, or terrible headaches, or difficulty with the focusing, you want to have a good evaluation by either a mental health professional or a neurologist or your medical doctor or someone you trust and someone you feel is competent to give you the answer of what you might have going on. They might order blood tests for you. They might even do PET scans, brain scans, if it's really severe, if it's something that they haven't been able to figure out. Often people will put you on medications right away, which I'm totally not against at all if you need them. But oftentimes people are put on medications before they really know what's happening. So we want to keep that in mind when we take the holistic functional approach, because we don't just address the disease or the symptoms. We're not just healing we're healing your aggression, we're healing your anxiety. We want to heal the body as a whole, obviously. So it's more than just woo-woo medicine. It's more than just yoga. It's all that stuff too. But we want to make sure we have a good, solid medical evaluation, a good, solid physical and history. We want to know your genetic history. And we want to know how to treat it. We may or may not end up with giving you medications. We may or may not end up giving you medications and herbal medicines. There are all kinds of things that can treat. Chinese medicine has been treating mental illnesses the same amount of years as every other health profession. Let's say even longer, even thousands of years. So this is no news to the Chinese, they have an increase of mental illness and an increase in anxiety and depression like the rest of the world. But this is an ancient kind of problem that's been dealt with in many ways in many years. So again, the holistic care not only looks at just the diagnosis, but your whole body. It takes a medicinal approach as well as complementary approach when needed. Okay, so why would you choose holistic health over other types? You might want to know that, we have to deal with your spirit. We have to deal with your spirituality. We have to deal with your physicality. And those are the kind of things that I think is severely lacking in the Western medical world. They don't seem to focus so much on your lifestyle and your diet and your stress levels and things. And some of them do. I really want to say that there are many good doctors out there, so many. But unfortunately, there are those who just lack that approach, that holistic approach. And you want to kind of avoid those types. So do your homework and see who's a good doctor to go to. But I want to look at the causes of mental illness. Again, let's look at the scientific approach just for a minute, because this is common to both Western and Eastern medicine. You have to know what's going on. So there's these basic neurotransmitters, that when they're in good balance, they keep you healthy and they keep you, they're mood stabilizers, and they help you with your whole mentation and your alertness and so on. And I'll go through one at a time very briefly. We have norepinephrine, which regulates your cardiovascular system and helps regulate your pain sensation. So if somebody is extremely sensitive to pain, there might be an imbalance in their norepinephrine. If you're extremely freezing cold or extremely hot all the time, that could be a hormonal imbalance, including a norepinephrine. That's something can be tested. Serotonin, everybody knows about serotonin. It's from tryptophan. We find it located in two places in the body in particular. We find it in the central nervous system, the brain, and the spinal cord. But also now, recent research has shown there's a lot of serotonin being produced and found in the digestive tract. So doesn't that tell you right away that, wow, we better get our digestions in order, because serotonin can be normalized and improved and stepped up and stimulated by just having a very good, healthy digestion. What does serotonin do? It regulates your responses to aggression, anxiety, appetite, sleep, mood, temperature, and probably more that I'm not aware of. Now, everybody knows about dopamine. Oh, by the way, serotonin, when people take antidepressants, they're serotonin uptake inhibitors. So that means they inhibit the body. They're called SSRI medications, and they inhibit or prevent the uptake of serotonin so that you have more in your system where you need it. So you have more of the serotonin to help you regulate all these difficulties like anxiety and aggression and so on. So the SSRIs help you keep that serotonin level at a good place. And again, I'm not pro-drugs. I'm not against drugs, but I try other things first before we turn to these unless it's absolutely necessary. Dopamine you've heard of. It's called the happy hormone. Why? Because it's a hormone too. The other ones are amino acids that influences your movement. So you don't have jerky movements. People with Parkinson's disease, as you know, it's not a mental illness, but it is a brain disorder. And people who have that jerky movements and they can't stop moving their head and they're shaking all the time, or people with seizure disorders have a lack of dopamine in their system. Memory, people who have lack of memory, brain fog, there's usually some kind of dopamine imbalance there too. The dopamine is called the pleasurable reward hormone. So that's why they call it the happy hormone. And so if you have enough dopamine in your system, you should be a little bit on the happier side and not on the depressed side. People who are depressed are known to have very low dopamine and serotonin levels. Motivation is also something that's regulated by dopamine. There's amino acids called GABA and glutamine, and they are good at the synapses, helping just everything run smoothly. The oxytocin is, we see think about obstetrics when we think about oxytocin, but it's also called the love hormone. So if you have enough of that in your system, mostly women, but men also have it too. Oxytocin is regulates female hormones especially, and can help keep your mood elevated if you have a good level of that. Endorphins, we all know endorphins are the pain reliever neurotransmitters. So if you have a high level of endorphins, you're going to have natural pain relievers in your system. And if you have a lack of endorphins or there's an imbalance, you're going to have extreme pain when you maybe shouldn't have. Okay, just like to be, again, a little bit technical about it, you can see tryptophan is the beginning, the precursor of serotonin, and it's all involved. There's all these different chemical reactions that happen to form the serotonin, and you see vitamin B is involved, riboflavin, iron, magnesium, zinc, vitamin C, folate. All those are involved in the process of making serotonin, and not just serotonin here, but also melatonin, also that helps you sleep and regulates your sleep-wake cycle and your circadian rhythm. I forgot to mention that, but it's there too. Also, the vitamins I'm talking about, vitamin Bs, especially magnesium, zinc, and vitamin C and folate, are also very, very important in all the nervous system development. So that means all the neurotransmitter development as well. And we do know when women are pregnant, they have them take plenty of magnesium, zinc, and vitamin C, and especially folate to help the baby in utero develop their nervous system to the healthiest level it can be. So we want to look at causes of mental health, poor mental health. Let's say we have a regular mentation. Let's say you don't have a diagnosis. This is not a class on the science behind mental illness necessarily, but we just want to know that there are scientific things we do look at and blood tests we look for and things like that. And there are biochemical changes that occur that can cause a lot of mental disruption. Mental illness can be the whole variety, again, everything from just plain anxiety and depression, which can be very debilitating, but all the way to mood swings and aggression and anger and all those things that can go, excessive anger can go all the way to psychosis and schizophrenia. And so there's a whole gamut of mental illnesses. And then there's brain illnesses like Alzheimer's disease and ADHD. And, there's just things that I can't cover here, but we want to keep the brain healthy. That's the main thing. This is called a holistic approach to keeping the brain healthy, so that if you do have these issues and if you do need to go on medications, you can really increase your chances of having greater success, that these medications will work for you, or without medications, maybe you don't need them if you have your brain in good health. So Again, I mentioned in children, there's a lot of mental illness, a lot more than you think. They say one out of every 33 children might be depressed. There's so much teenage suicide right now. We really have to do what we can to really pay attention to our children when they change their moods. I always remember a rabbi saying that when the child is depressed or a child has sudden behavioral changes, doesn't want to talk to you anymore, or starts bedwetting before, he says there's something really wrong. You need to pay attention to that child. And it may not be a mental illness, but boy, if you can address that issue, whether it's nutritionally or whether it's with therapy or whether it's just giving a caring, listening ear, finding out what's wrong and removing the problem, we can prevent a lot of mental illnesses or a lot of mental disruption in people, and especially children. And again, one rabbi, the same rabbi, I don't know if you agree with this or not, but I kind of thought about it a lot. He said when kids turn to drugs, it's all a lot of times because they're a lot of really anxious and they're very depressed, and people aren't listening to them and they don't care. They might have had sexual abuse, they might have had all kinds of things, and maybe nothing, but they need to be listened to. And he says, and if a child turns to drugs to soothe themselves and to self-medicate, then he said there was somebody asleep at the wheel when the child was going through trauma. So, again, you can't be there for every step of your child's life. Things happen at school, things happen in swimming pools, things happen when they're waiting for a bus. People can be very nasty to your kid, whatever, teacher's not nice. Who knows? But you can't be there for every single part of your child's life. But when you are with your child and when they tell you things, please listen, okay? You can help prevent a lot of anxiety, depression, and possibly, God forbid, a suicide in your kid. So another thing with mental illness, we see a lot of things that we look a little bit further into with the holistic model. In addition to the warning signs for mental illness, which could include a marked personality change or inability to cope with problems in daily activities, strange or grandiose ideas, excessive anxieties. You have a kid who just is afraid to, go to the store with you, or, afraid of monsters under the bed. There's excessive. Some of these are normal, obviously, but people are afraid to do things, and this is sometimes excessive. You can see prolonged depression and anxiety. So let's say if somebody has a breakup, one of your kids or one of your friends or your mother, father, whatever, sister, brother, they have a breakup and they stay depressed for really a long time. I know somebody personally like that. Really, honestly, you wouldn't believe it's a 30-year depression over losing a spouse from a divorce. And like part of me wants to say, like, get on already, move on. But there's something chemically imbalanced about that person that you have to address so they can move on. They maybe have to fix their nutrition or get a medication. Who knows? But this person is 30 years depressed over a divorce. It's very, very sad. If you see changes in sleeping patterns, you might think there's something wrong with the brain. We're going to look at brain health here. We're not just talking about mental illness. Let's talk about brain health and maintaining it. If you see extreme mood swings, high or low, if you see sudden abuse of alcohol or drugs or any kind of violent behavior. So a person that exhibits any signs of these should be seen by a qualified healthcare professional. And you want to get to the bottom of it again. Go to a professional first and maybe you don't even want the diagnosis, but you want to see what you're working with so that you can move on from there. And then you also include all the holistic treatments as well, which I'm going to get to. I saw a couple of articles about dopamine imbalance. Now, what do we say? Dopamine is your happy drug. No, dopamine it's not just a mental illness because, your brain suddenly doesn't produce enough of it. Here's what can cause problems with dopamine, for instance. Infections, chronic infections, and antibiotic use on the boundary, prescription medicine. Leaky gut. If you have a digestive system that has such bad leaking that it doesn't hold in any of its nutrients and vitamins and minerals, it just lets everything out like a open mesh. Trying to think how to describe this is so difficult, but you should have tight junctions normally in the cells of your digestive system. If they're any loosened up at all and things could flow back and forth, you're going to have a lot of problems with not just emotional health and mental health. You're going to have problems everywhere else. So leaky gut is something to address. We want to test for amino acid deficiency. We want to check for vitamin deficiencies. We want to check for gene mutations, which is something only geneticists can do. But if you have that in the family, and there's something called methylation gene mutations, there's mutations of genes. We can look these things up and we can do blood tests and we can get to the bottom of what is going on with somebody's change of behavior or change in mental health status. Okay, so before we get to the principles of adopting a holistic lifestyle, I still wanted to go on again. I have way too much printed out here. That's the story of my life. I cannot. I need to be constantly editing myself, or it gets way too long. Okay, so again, let's go back to the infections. I just want to go back to that again, just for a minute, because it is important. Okay, that's Alzheimer's. Um, okay, they say Clostridia infection can cause excessively high levels of dopamine. High levels of dopamine, that's an imbalance also. Then you can go into psychosis from that. You can trigger the fight or flight response if you have excess dopamine, like Parkinson's, schizophrenia, anorexia nervosa, and Alzheimer's. If you have an amino acid deficiency, they're the building blocks of your protein in all your cells and your DNA as well. And if some of the amino acids are made or they're inadequate in your body because of poor nutrition, you will have a poor system all overall. Your digestive system is off. Every organ of your body will be weak. You'll have malabsorption from the leaky gut syndrome, as we talked about. If you have a vitamin deficiency, sometimes a dopamine imbalance could come, and serotonin, and all the neurotransmitters, transmitters, by lack of B vitamins in particular, which we mentioned earlier. B vitamins are very, very important for neuronal health, and they're called neuroprotective. So we want to keep up with those vitamin Bs. And if you're having malabsorption syndrome, if you have difficulty absorbing things because you have a leaky gut, you can't keep anything in, that means you could take all the supplements you want and spend all the money you want in drinks and juices and everything, and it's not going to stay in your system. It's just going to go out as easily as it came in because your body's not absorbing it. So that's tough. Again, when we have these mutations of the gene, it's not expressing itself properly, and methylation of the gene is another problem that can cause dopamine and serotonin to really go haywire in either direction. Again, the leaky gut is something that we really like to focus on because we've mentioned before that serotonin is produced there. And if you have a lack of serotonin, all kinds of different mental health issues can occur. So you have to understand your underlying symptoms, and you can go to an integrative medicine professional. I could also evaluate people. There are people, nurses, doctors, all kinds of people you can go to who have the holistic approach. It doesn't mean they're just going to direct you to yoga and Tai Chi, which they probably should do, but they're going to do all of these different blood tests, and they're going to ask you all these in-depth questions to see if there's any reason why you are having, difficulty of imbalance in your neurotransmitters. It can happen from all of these things. And again, just to mention a little bit about another brain disorder, Alzheimer's. We're not talking about that so much today, but this happens too with all the imbalance of the neurotransmitters, especially dopamine, misplacing things, poor judgment, mood changes, memory loss. It doesn't always happen because you're getting old. It could be because of the way you're feeding yourself. It could be because of a head injury that you had in the past. It could be because of your digestive system, whatever. Okay, let's talk a little bit about Western medicine. I just want to say I'm a big believer in Western medicine. I've been part of Western medicine for over 30 years. But I can tell you this, one of the reasons I went into alternative medicine or integrative medicine is because I believe in integrating the best of Western medicine with the best of Eastern medicine, or integrative techniques, alternative, complementary. There are a lot of different words for it. I could never abandon Western medicine. We need it desperately. But their view about mental health, as I mentioned before, is pretty cut and dried in a lot of instances. You go to a psychiatrist, you go to your doctor because you have headaches, or you think your child has ADHD, or you have somebody who's depressed or anxious. And the first thing they do is they give you a referral for a psychiatrist, maybe a neurologist, but usually a psychiatrist. And 9 times out of 10, the psychiatrist is just going to say, and give you a prescription for a drug. And that's really very oversimplifying, and I hope I'm not insulting anybody, because I see this just more often than not. And so this is all before they ask you, what is your lifestyle like? What are you eating? What is your stress level like? What is your trauma been? Those are things that are super important in this evaluation. And they often don't ask these questions. Okay, so they might even direct you towards a support group, or they might try to direct you towards therapy, which is great too. That's all good. But in the complementary and alternative integrated method, which is holistic, looks at the whole body, we look at the root cause of something. We want to see what's going on with you. And if it's something we can't help by changing your diet and getting you to relax and getting you to address your stress in your therapy and things, or maybe post-traumatic stress, trying to get you to get that to really be released, then you have to go on that medication. But really, there's a lot of other different things you can do along with it. They work very well together. Also, if there's a severe mental illness, like severe depression that you just can't shake. I mean, in the old days until now, there's something called ECT, which is called electric shock therapy. Um, there's other therapies like prescription medicines that I mentioned, talk therapies. You can be hospitalized in a residential situation, which is very extreme also. And of course, to move on to other kinds of therapies, there even, I think the Western medicine model is even looking at things like EMDR, which is eye movement muscle desensitization, which they have you track your eyes back and forth, and it's a beautiful therapy. It's an EFT, which is emotional freedom technique. There are lots of good things out there that can help calm the mind and release trauma. So again, once we get through your Western evaluation, make sure you don't have anything very seriously wrong with your brain, and your neurotransmitters and your blood tests are pretty good, and you don't have a brain tumor, God forbid, or a head injury. Let's focus on what we can do to help people with major depression, to help people with anxiety, because those seem to be the ones that are the most common in all groups, in all ages. One of the things we want to do, including in the complementary therapies and investigation, is to check hormone levels in women especially, balancing the estrogen and other hormones. We want to make sure you have adequate amino acid availability, they call it, which means the body, that communicates through the neurotransmitters. It's all made of amino acids. So if you don't have enough protein in your body or healthy amino acids added to your diet, you will not have good connections between the cells in your brain. You want to identify correctional nutritional deficiencies, as I mentioned. We want to look specifically at vitamin A, folate, B12, B6, and C, zinc, magnesium, iron, selenium, choline. They're all essential new ingredients that are essential for good brain health. And you want to look at your daily habits and the foods you eat, and you want to try to adopt a holistic lifestyle. So organic is mentioned here. I mentioned this in pretty much every webinar I do, that eating organic is ideal because there's no pesticides and they rotate the crops, and there's way more nutrition per vegetable and fruit that you have anywhere else. We have, it's a scary thing that we are not eating the same foods as our grandparents and our parents ate, and even us as children who are older people now, we're grandparents now. Our food was pretty healthy. And we knew we had a good amount of vitamin-rich food. Whatever grabbed an apple, we knew that 70% of it or 80, 90% of it was all nutritious for us. And now when you grab an apple, if it's not organic, you wonder if there's even like 10% that's got nutritional value to it. So you really, you might have to supplement quite a lot. I see more than ever, supplements are really very valuable, and they're almost necessary. Okay, we want to talk about food. I was going to do this. What else? Okay, here's the holistic approach to good mental health. We're going to change your diet. We're going to upgrade your diet a lot. You want to make sure you get plenty of sleep. I didn't even put water here because, as you know, hydration. I'm really remiss here. Hydration, especially in the summer. Hydration is the number one component in our body that helps everything function better. Our body is made of 70 to 80% water. We need it to flush all the toxins out. We need it to soothe and bathe all the vessels and all the functions of whether they're chemical functions or whether they're physical functions. Water, hydration, okay? Sleep, exercise, managing stress. I'm going to go through these a little bit each. You focus on thoughts. That would be talk therapy, or there would be some kind of therapy like EFT or EMDR. Behavioral therapy, you want to notice the reactions. Environmental, you want to see what's going on with toxins. There's all this study going on saying toxins are a number one cause of ADHD in kids. We have toxins in our pesticides in our food. We have toxins in pollution that we breathe. We have additives and all kinds of chemicals in our shampoos. I mean, it goes on and on. It makes you very scared to even walk out of your house, truthfully. But those are the kind of things that you could have a very, very sensitive person in your house. Just taking those toxins away and put them on a little bit of a detox program could really help them. You want to address spirituality, and you want to give love and compassion to yourself, because this is also something you have to learn how to be forgiving first and foremost of yourself. And then you can get to the bottom of what's going on, and you release a lot and relieve a lot of bad emotions. I want to talk a minute about the stress also. We want to manage the stress in your life. One of the main causes for dementia, depression, anxiety, and chronic illness is stress. We know that stress causes problems. We know stress aggravates problems, and there's some things you just can't take away. If you are struggling for money every month, if you're living in an abusive situation, you could try to take care of that, But if it's something you can't take care of, then you're stuck with that stress. You're living in a stressful country. If you're living in a stressful relationship with like a kid that's difficult, or a husband or a wife, and you're not going to leave that person, you have to learn how to manage that stress. So that's where you really need to reach out to health professionals of all kinds, including yourself. You have to learn. This is where the yoga comes in, and where the Tai Chi comes in, and the deep breathing techniques, and all those things together with the good nutrition. This whole end of this webinar is geared toward just complete, general good health maintenance, and not just mental health, not just brain health, but for all health to be normalized and kept up properly. This is what you recommend. Decrease the stress as much as you possibly can. If you've got a terrible job and the boss, and you can't leave that job, okay, you got to find a way to deal with that boss, or leave the job. That's what happens to me a few times in my life. Again, we talked about the toxins, unhealthy diet. There's one thing it said about dairy, which I don't know if people all agree with, but here's what I read. A substantial amount of studies have been conducted over the years associating dairy with schizophrenia, ADHD, depression, and other brain chemistry imbalances. So that might be something you want to investigate. It's not across the board, but they do see associations. So maybe avoiding dairy products like cheese, yogurt, butter, who knows? Maybe that could do wonders in attacking these problems in the early stages, and even Alzheimer's. Okay, so let's talk a little bit about the diet. And again, I have shown this to so many times in every different type of webinar I've done, whether it's on gut health, or whether it's on heart health, or whether it's on stress in your life, or whether it's on pain. This is the same slide. I realize I've made this slide so many times, but this is what you want to have. The best foods for brain health are also the best the foods for health, overall health completely. And again, I've mentioned this so many times that if anybody was living this kind of healthy lifestyle and diet in particular, and avoiding junk foods and avoiding processed foods and avoiding sugars, these people did really well during Corona, most people, because they were already in very, very good shape. Okay, and that took care of their bodies way better than the rest of us, maybe. I won't say who. Okay, so we know leafy greens. I want to go to that page because that's a little bit about everything. Yeah, it's all here in my 30 pages, which I'm not giving over, don't worry. Very lengthy. Oh, I just want to say too about the diet. The Western diet is just known to be biggest damage to all of us. We're overweight. We have too much sugar. We have too much salt. There's too many additives to the foods. So the importance of good nutrition cannot be marginalized. You have to do the best you can. And it says here too, there's no coincidence that countries that practice westernized diet also experience a high rate of age-related cognitive decline. So people like my age, you have to be very careful. We have to be very careful of eating all this processed foods because it'll increase the rate of aging, whether it's your brain, whether it's your skin, whether it's teeth and bones. All kinds of bad foods for you, and additives and chemicals, alcohols, they're terrible for the longevity of a person. And then on top of that, it damages the brain health. So your green leafies, your spinach, lettuce, collard greens, Swiss chard, and all that stuff have good vitamins, A and K, and calcium. We want to talk about our cruciferous vegetables, which are so, so important, and the broccoli and the cauliflower. And they just have so many good vitamins and minerals in them that are also good for brain health. They give you the fiber also and the folate that you need to help with the vitamin Bs. Good vitamin Bs, vitamin Ks. Turmeric is something that all the rage these days. In Chinese medicine, we call it a warming and a moving herb. So if people have arthritis, it pushes the blood, it thins the blood a little bit. So you have to be careful if you're on blood thinners. So turmeric will push that blood and warm it up and get it to go further down to the fingertips, to the toes, around the joints. So it helps relieve pain. It's anti-inflammatory, helps relieve pain. So this is also good. You want to eat anything that's anti-inflammatory. It will also be very healthy for your gut, digestive system, your gut health, and your brain health. Again, this is the same slide for everything you want to take care of in your body. So let's just focus on it. Berries, of course. The berries are full of antioxidants and full of vitamins too. So you want to keep the dopamine and the serotonin in good stead if you're having lots of berries, because you will have all the manganese and the magnesium and everything you want to eat. Raspberries, cranberries, they're good in fiber also, and they have the bioactive compounds that help produce serotonin, dopamine, and regulate them as well as norepinephrine. They also say that berries can improve your memory. Coffee's in the same category. It's an antioxidant too. It's supposed to be brain protective, brain health. So all these complaints about coffee during the years, I don't know. I've been seeing more and more positive results about coffee. That it's an antioxidant and you can drink it freely unless you have an allergy. I have some patients that they have extreme pain. If they have gout or something, you have to be careful about coffee. Not everybody can, but if you're able to drink coffee, it's not a problem. It's in fact helping your mental health and your brain health. Green tea is the same. Green tea is a naturally caffeinated or uncaffeinated, decaffeinated, you get it too. It contains compounds that will be very beneficial for your brain, and it's also antioxidant, anti-inflammatory. So it really benefits all your bioactive compounds and all your neurotransmitters. Green tea is great. I have everybody drink it every day. I even buy it for my patients. I tell them to make a big liter of water so you get your hydration. Put a cup of tea in there that you made a hot cup of tea, but put it in a water bottle this size. Put it in a bottle like this, and then most of it's water, but then a little bit of tea, and it tastes really good. And before you know it, your bottle of water is gone, and you've hydrated yourself, and you've given yourself your antioxidants and your green tea. Fatty fishes and nuts and legumes we know have the healthy fats that we need for brain health. Brain is over 80% fat, so you need it for your nervous system to function properly. And if you have a low-fat diet, you're going to see people who are very, very cranky, and you're going to see people who are have headaches and can't sleep very well at night. Fat, really a good healthy fat, not the fat that's in processed foods, but the healthy fats that you find in fishes and nuts and legumes. Those are the fats you want to focus on, and the oils as well, like olive oil, avocado oil, and the healthy coconut oil. Okay, supplements. What are we going to take in terms of supplements? By all the B vitamins, the B3, B6, and the folate. We want to really focus on those because they are neuroprotective. B12. Okay, if you get lucky enough to find a supplement that has all of these in it, wouldn't that be great? Because then you wouldn't be taking so many pills. But vitamin B3 in particular stimulates the production of tryptophan, which is the precursor of serotonin. Okay, so you really want to have enough of tryptophan in your system. We used to see it on our cereal boxes, but I don't believe they had a lot of stuff in there. Riboflavin, remember all those additives? They were really good. They were good for brain health. And niacin and all those things. Riboflavin, important cofactors. They're called cofactors in the synthesis of serotonin, dopamine, norepinephrine. B6, of course, is the one we hear most about, and B3, and that's very neuroprotective. And for all ages, people should be on some kind of B vitamin. And again, the folate, pregnant women should take that to help develop good nervous systems and healthy nervous systems in their babies. B12, we talk about that. It's most easily absorbed type of B vitamin there is. And we have zinc. That's very neuroprotective, but not only that, it builds immunity. So people take that a lot during Corona times. I would take it till today myself. Magnesium, that comes in different forms, but there's different forms that you can ask your pharmacist about. That there's certain forms that are good for mental health because the glycine part of it has calming properties. And also magnesium is good for your nervous system and your extremities as well. People with restless leg syndrome usually have a magnesium deficiency. When they take magnesium supplements, they feel better. Again, the omega-3s, you can get them in foods or you can take them as supplements to nourish the brain health and keep that fat in the brain the way it's supposed to be. That I always remember studying in nursing school that all the synapses they show pictures of the nervous system and the neurons jumping from place to place, and they were smoothly jumping over this nice, smooth, like slippery substance, which was the brain fat. The fat that I want to say the word fat, but you know what I'm talking about, the lipids that would keep the smooth flowing of the nervous system. And in fact, I always have a story about that I knew a baby that was born of a mother, of a few unfortunately, where a mother was a drug addict, and the baby was born going through withdrawal, and that baby was so skinny, had no fat on his body at all, and also they decided that the baby needed supplements of lipids, more lipids in his system because his brain was probably lacking the lipids and everything hurt him and he was screaming and he couldn't sleep. And once they stepped up his nutritional health and helped by adding more extra fats to his diet, he was fine. And it gave me that image again of the nursing school of seeing that nice slippery jumping of the nervous system. If you don't have it, you're going to have an irritable child, or at the very least. Okay, iron, of course, we know that helps everything. It helps build bones and the blood in our body. And so where do we go from this way forward? How do we recommend things? Again, we want to step up our diet. We want to have sleep and exercise and hydration. We want to manage our stress and our thoughts, our emotions. We want to go through different types of therapies, which I don't have written here. But again, we want to do yoga. We want to do Tai Chi. We want to go to stretching, and we want to do different types of exercises that are very, very calming. We want to learn how to do deep breathing exercises. There's all kinds of YouTubes available to teach people how to focus and concentrate by just breathing alone, the breathing techniques. I am not good at those to teach those, but I'm trying to learn myself. But even breathing, they call it breath work. It helps calm and focus and center people. So all those things together, we put it together with our Western medications and our Western knowledge and medications. Hopefully you don't need, but if you do, please don't run away from them, because it's like having a cardiac medication that you might need or a seizure medication. You don't want to not take something just because it's a medicine. You want to make sure it really is truly helping you and really is truly doing what it has to do. And there's nothing else that can be done except our medicine. So this way forward, we want to make sure we do continue our neuroscientific investigation of both Western and Eastern medicine. And we want to make sure that our liver is in good health also, and all of our organ systems, and the nutrition is up to date, and pay attention to the first signs of poor mental health in anybody in your family or yourself. And don't wait to get treated, because it could save your life, literally and physiologically, and it can help you just live so much better. And you can help someone you love if you pay attention and get them the help they need. So without further ado, we're going to stop for today, and we're going to say goodbye, and I'll see you next time. I'm going to be doing this once a month for the next few months for the summer. If you want to write to me, you can write to me at RBS Acupuncture at gmail.com. Be happy to answer any of your questions. You can check my website, which is rbsacupuncture.com. And RBS stands for Vermont Beit Shemesh. And if you want to phone me, you can just get my phone number from either the email or the website. Got a lot of information of all different types of treatments for people with not just brain health problems, or acupuncture, Chinese medicine can help them quite a lot. I take care of a few people with depression and anxiety, and we're making great inroads. I see children with ADHD. We're doing well. I see a couple kids that have different nervous system disorders, and older people with Parkinson's. I've been trying to help them too. So, we can't always cure things, but we can surely help you manage your symptoms of anxiety, depression, sleeplessness, balance problems, digestion problems, everything. So give us a call at RBS Acupuncture. I'll be happy to give you a free consultation. And have a great week and healthy month, everybody. Thanks for joining.